So there's a lot of activities going on within the hospital to ensure that both patients are safe and that our staff is safe. Number one, in terms of staff safety, we are really emphasizing the use of personal protective equipment, or PPE. This is the equipment that we need to stay safe so that our workforce can continue to take care of patients in the community. You'll see masks that are being used. There are a couple different type of masks. One are surgical masks. Another one is a little bit better mask called an N95 mask. We also have protective face shields, goggles, gowns, gloves, and all the appropriate equipment so that we can stay safe. A couple other things that we're doing in the emergency department to keep staff safe: we are cohorting patients. So when you come to the emergency department for care, if you screen in for certain symptoms that are concerning for COVID-19, you may be cohorted to a certain area of the emergency department. We're trying to keep as many people with potential COVID symptoms together so that we're not spreading illness, which is so highly transmissible and contagious. We're trying to keep that rather contained within different areas in the emergency department. What we're doing to help patients who come in, we're doing early identification and screening to identify which patients are most at risk for COVID. So we want to identify, we want to isolate, and then we want to inform. So how that works is when you come to the emergency department, you will be asked a series of questions about symptoms you may be having, specifically fever, cough, and shortness of breath. Those are the most common symptoms we see with COVID-19. Then we'll ask about close contacts with other people who may have COVID-19, and we'll ask about travel, especially to hot zones where it has been noted that there have been more cases. This is a changing topic, and this will change throughout the next several weeks about which areas are the hot spots. Once we identify if you're at a high risk, then we isolate. So the first thing that we'll do is we'll put a mask on you. This limits the amount of transmissible virus that each patient could potentially give to other patients, to family members, and to staff. We will put you into an appropriate room with the door closed. We are going to limit the amount of visitors because we want to prevent other people from being infected. Once you're in the room, there's testing that can be done, but testing has to meet certain guidelines. There are DPH guidelines about which patients should be tested. So that's constantly changing. But as of right now, patients who should be tested are patients with symptoms. If you do not have symptoms and you're concerned that you came in contact with someone with COVID-19, the best course of action is to call your primary care provider. We do not, at this time, we are not recommending that patients who are asymptomatic come to the emergency department. We have alternative ways to give you the information that you need so that you can follow the most updated guidelines and keep yourself safe, keep your household members safe, and keep the community at large safe.